Well, let's get more insights still on this. We're joined by Jackline Kiarie, who is the program manager at Amref Health Africa. She joins us from here in Nairobi. Jackline, why is Africa experiencing a surge in COVID cases?
Thank you very much for this invitation. And I think I want to agree with what some of the other speakers have spoken. So in Africa, we are currently reporting all the three variants of the coronavirus, the Alpha, the Beta, and the Delta. And the Delta happens to be one of the worst, most transmissible variants that we have around. Has been reported in South Africa, in Kenya, as well as Uganda. And that might be part of the reason why we are seeing quite a number of cases. In the last 1 week, for example, we've seen a 30% increase in the number of cases being reported. And if we go by what is being reported in the other sides of the world, then where Delta is contributing to most of the cases being reported, then we can also make the same assumption that the surge we are seeing is partly because of that. Other than that, we are seeing really good vaccine coverage in the rich nations, a situation that has not been replicated here in Africa. If we go by the reports, for example, that we're getting from Africa CDC, only about 3% of the population has received the COVID-19 vaccine, half of which has received the double doses that are required to keep some of these variants away. So again, the low coverage in vaccination status in Africa is part of the reason why we are seeing the increase in the number of cases that are being reported, especially in the last 1 week. Other than that, I think most of us realize that we've been at this for the last 1.5 years now since the first cases were reported in the region. We've had several waves being reported in some of the African countries. In Kenya, for example, we are in between the third and the fourth wave, and therefore sometimes there's pandemic fatigue. Sometimes the risk perception goes down. You know, every time you have a wave and then the numbers go down, then there's a feeling of we are now safe. We can lay down our guard because we are not at risk. So because of that, we are seeing little observance of the public health measures. We are seeing a lot less people wearing their masks as they should be. We've seen people return to the churches, and these are really conducive environments for spread of the virus. So because we've been at this for so long, people have taken down their guard, and we are seeing relaxation of the public health measures. So that might be one of the factors that's contributing to the rise in the number of cases we are seeing in the region.
And Jackline, speaking about response, how then should organizations like the WHO and CDC go about helping Africa, especially those worst affected nations?
Mm-hmm. We've seen them play a very major role in supporting African countries prepare, first of all, as well as sustain the response in the region. WHO, for example, is playing a very critical role in helping countries sort of pause and reflect on how far they have come in the response, what have they done well, what have been some of the challenges, what can we do better in the remaining period to ensure that we can sustain some of the efforts that have been put in place so far in as far as observance of public health measures is concerned, as far as making sure we have the right infrastructure and the right capacity to roll out the vaccinations. So part of their role is planning, coordination, a role that they've played very well. We've seen Africa CDC provide us with weekly updates on how we are doing as a continent, what we should be prioritizing, whether it's testing, whether it's making sure we can roll out, whether it's ensuring that we can address the vaccine hesitancy issues that we've seen. So very critical in planning and coordination. We're also seeing them lobby for increase in provision of the vaccine, especially with the rich nations, because we obviously need to increase our vaccine coverage. We've seen it work out there. We have seen the number of cases go down, for example, in America, because their vaccine coverage is quite good. When you compare that with Africa, where we only have about 3% of the population covered, then there's definite need to improve the number of people who are getting the vaccine. And therefore, we are seeing WHO, Africa CDC lobby the rich nations, first of all, to provide or avail more vaccines, especially through the COVAX facility. We are seeing them go ahead and have discussions with manufacturers and see if we can strike deals to begin our own vaccine manufacturing here in the region. Other than that, you also see WHO and CDC try and address the other emerging issues in Africa. Like we all know, COVID is only one of the issues that we're dealing with as a continent. We do have Ebola that has been reported quite a bit in West Africa, something that has just been dealt with. We are seeing them support us in routine immunizations, especially here in Kenya. We now have measles campaign. In the last 2 weeks, we also had the polio campaigns going on. So other than addressing COVID, they're also reminding us that this is not the only issue that we should be dealing with. And they're working hand in hand with the governments in Africa to just ensure that we don't drop the ball on the other issues that really affect us as a region. So very critical that this is sustained, and I think we want to lobby all support that we can give to these two regional organizations to really make sure that they can do their job well, to assist governments in Africa to respond to COVID, as well as the other issues we face as a region.
Right. Jackline, thank you for speaking to us on Africa Live. Program Manager with Amref Health Africa, Jackline Kiarie, joining us from Nairobi.